Good morning and welcome back to Great Day. It's 8:41 as we welcome to the desk Dr. Mark Isaacson. He's from Des Moines Orthopedic Surgeons, one of the most highly respected organizations on the planet when it comes to taking care of people. And you are a specialist over there.
I am, yeah. I recently finished training and I'm a total joint specialist, so focusing on hip and knee replacement.
And how common of an occurrence is this?
Actually, it's really increasing in terms of frequency in our country. Just for some basic numbers, if you compare 2000 to what we're projecting in 2030, knee replacements will go up 200% or 600%, sorry, for knees and 200% for hips. So the volume is significantly increasing.
And why do we think that might be the case?
I think our population's aging. The baby boomer generation's coming to wanting joints done. So that and people's activity, we're just more active, so we're wearing through our joints quicker.
And is it because we live longer as a population than we used to? And
certainly.
Sort of our warranties are expiring?
Absolutely. Exactly. Some of the patients that might not have needed a joint replacement years ago are still with us, and so certainly replacing in older patients and giving them good quality of life.
Does it go with how the surgery has changed as well? I imagine the hip replacements that you're doing now are vastly different than you were doing, say, even back in 2000.
Absolutely. The technology has advanced significantly since even 2000 to today, which gives us better longevity on our implants. So one of the big benefits to patients now is if you get a hip or knee replacement or shoulder or ankle, if you get it when you're younger in your 40s or 50s, there's a good chance or higher likelihood you won't need a revision done because the technology is so much better.
Oh, really?
Wow.
So,
yeah.
So the life expectancy of a joint has increased?
Absolutely. That's one of the biggest benefits currently. I think the big fear historically was you get a joint at 45 or 50, you're going to have 2 or 3 more.
Right.
That's exactly
you used
correct.
to hear like
Correct.
every 8 to 10 years you would
Correct.
need to get a new one.
Currently, I would say most surgeons would educate their patients every 15 to 20, some even 25. There's a lot of literature out there promoting the 25-year joint or whatnot.
Wow.
Time will tell, but certainly I'd say more the 20-year as opposed to 8 to 10.
And what is the biggest change from, say, back in, even if we go back as far as, say, the 70s or something, when they first start becoming popular,
Sure.
what's the biggest change from back then till now?
Probably 2 things. One, how we implant the actual prosthesis. A lot of times it used to be fixed with cement in somebody's hip. Now we do it what we call press fit, so your bone actually grows onto the implant. So it's a lifelong bond.
A press fit,
Correct.
like a ball joint.
Correct.
Oh, okay.
And then probably the second would be the articular surface. So what you actually walk or do activities on is a piece of plastic. We've advanced that technology significantly so that plastic doesn't wear down near as fast. That used to be kind of the rate limiting step. You'd wear through that plastic quick, and it's significantly better now.
Wow.
And what kind of downtime are we talking for each one of those surgeries?
That's a good question. That I think is a little bit patient variable, but usually a week or 2 really where you're real slow after surgery, probably using crutches or a walker. After that, though, you can pretty much progress at your pace, pain relative to your pain control. Total downtime, it depends on what you do for work, I guess, but I would say in the realms of 4 to 6 weeks probably.
Now you said average ages, you've been talking 40s, 50s, maybe older. How do you know you're getting to the point where this is something you might consider? We all have aches and pains as we get older, but when do you get to the point where it's like, I need to consider doing a procedure like this?
Sure. I always discuss with my patients when it becomes a quality of life issue. When you can't get up and go for a walk around Gray's Lake, or you can't get up and do something you enjoy doing, that's probably the time that you need to consider getting your joint replaced. Everybody has different triggers that say it's time, but I base it on what do you like doing and can you do it anymore. If you can't get out and golf, you probably need your hip or knee or shoulder replaced.
You seem like a nice person, but how do we make it so that we never have to see you and have surgery?
That's a good question. I don't know if there's a good answer to that. We don't have a cure for arthritis yet. We have treatments for it, non-surgical included, but are more of kind of a Band-Aid effect as opposed to the definitive treatment, which now is surgery. Remaining active is actually good for your joints, contrary to what we used to think. The more active you are when you're older, you're wearing through your joints quicker. That's been disproven. So I would say staying active as you age, even if your joints are slightly painful, it's actually better for your remaining cartilage to be active. So it'll keep you away from the doctor longer.
So stay active, Parker.
Yeah, well, this job is taken care of.
All right, now let's look at the spectrum of what type of people would get this age-wise.
Sure.
What are some of your youngest patients and what are some of your older patients? Where does the spectrum lie?
Yeah, it's pretty broad spectrum. I don't think there's an age cutoff nowadays in terms of how young you got to be a certain age to get a hip, knee, or ankle replacement. Obviously, our technology will eventually run out, so if you're 30 and getting a knee replacement, you're probably going to need it again sometime in your life. But really, I would put that as how symptomatic are you, and what are there any other alternatives? If your arthritis is so severe, there's no non-replacement treatment. You can't get a knee scope or something done for it. I would say a 35-year-old's fine. Then the other end of the spectrum used to be, you got so to a certain age, you're not, we don't want to do a joint on you. You're only going to, have 5 more years of life. I think the quality of life that people receive from a hip or knee replacement or a shoulder or ankle replacement, I wouldn't say there's a upper age limit either, as long as they're healthy enough to undergo the surgery. So I know in my training we've done people in their 90s quite frequently.
In their 90s?
Yeah.
Really? That's got to be more than a shot in the arm. That has to be just amazing for people that age.
Correct. And they got to be a healthy 90-year-old. So it's not every 90-year-old, but somebody that still is active and wants to be in the community. So, but yeah, it's not infrequent to do that.
Anything we can do diet-wise, or is it just the old don't eat Snickers and pancakes and all that stuff?
Probably a little bit of what you just mentioned there. There's no particular diet I would say that's going to, improve the joint health throughout your body, but just a balanced diet, obviously, and activity, I think, is probably the key.
Sure.
And okay, what about taking various supplements, or do any of those things you see on TV? They say, oh, this will help your joint. They even have joint in the name.
Sure. And probably the most common is glucosamine chondroitin. You hear that a lot, and people give it to their animals too for joint health.
Your dogs, yeah.
Correct.
Yeah.
We still will support that. If somebody comes and asks about it, there's not any real proven literature that says that's going to make your joints better than if I'm the person that doesn't take it. But it certainly probably is not going to hurt. So if you want to take it and you're a vitamin person or a supplement person, by all means, go for it.
Now, where do you perform your surgeries at?
Well, I'm going to be performing at the downtown Methodist Hospital, so UnityPoint downtown. But we also, as a group, perform out Methodist West, and then at various surgical centers across town. Okay,
and you guys are going to have some seminars this fall, so as we get closer to it, we'll be able to give people information in case they have questions.
Exactly. Yeah, so later this fall, to the general public, some information will be released about a joint seminar.
And what would you cover in a joint seminar? Just if you know you're perfect for it, or?
Exactly. So that's the point, I think, of the seminar is to educate our patients.
Okay.
And we'll have a surgeon talking on 4 different joints. Myself, I'll talk about hip replacement, and we'll have another surgeon talk about knee replacements as well as ankle and shoulder replacements. So if any of those are joints that are bothering somebody, we'll have an expert talking about each of them.
Is it basically like carpentry with blood? Is that pretty much?
It's relatively accurate. The tool, if you saw the tools we use.
Thank you, Jason.
Have you ever heard that way of what you do for a living described?
Carpentry, quite a bit, actually.
Yeah.
Really?
Not with blood added to it.
Besides Jason's own when he's trying to build a chair or a table or something.
Yeah, but if you saw the tools we use, you might think.
So what are your parts you're dealing with when it comes to the joints? Like, what is that physically made of these days?
Metal. So it depends on what joint you're putting in, but for hip, for example, there's a femoral component, so in your femur, which is made out of a metal, either cobalt, chrome, or titanium. Okay. And then there's an acetabular, or the pelvic side, that's also made out of titanium with plastic in between.
Wow.
So basically what you're saying is you can build him and make him better than he was.
Okay. Hopefully.
Yeah, okay.
Yeah, hopefully.
All right.
Yeah.
That is so cool. Well, wonderful. Thank you for coming in.
Thank you. Appreciate it.
Explaining this to us. That is really
Thank you very much.
fascinating. Thank you for being here. It is 10 minutes before 9 o'clock.